Okay, perfect. All right, well, we'll go ahead and get started. So, this week's session is really focused in on barriers in access to telehealth. So, we have touched on this, kind of throughout. We've talked about, telehealth basics, we've talked about broadband. So, again, this is kind of something we've touched on throughout, but this will be more of a focused presentation specifically on barriers in access to telehealth. And it will also revolve, around rural clinics, rural communities. And really just focusing in on what those challenges might be that healthcare providers and patients are facing in implementing or accessing care via telehealth. And we'll talk a little bit about how we might mitigate those barriers and the work that's being done in North Carolina, again, to overcome those barriers for patients and providers as well. So, again, talking about the objectives for today, the first objective is to understand the various barriers that patients face in accessing care via telehealth. The second objective is to understand the challenges that healthcare providers face in providing care via telehealth. And then finally, to brainstorm ways to facilitate access to telehealth. So to start with, we just have this short video that kind of, talks about the topic we're going to be discussing today. So I'm going to hit play. I think hopefully the audio should work. This is my first time doing an audio with the PowerPoint live. So let me know in the chat if you can hear. All right, maybe just give me a thumbs up. But I'm going to go ahead and play the video. Okay, perfect. Okay. So I love that video because I really think it gives you, a good picture of all the benefits, right, of a telehealth visit, how it can help patients overcome barriers. So as we've previously discussed, I think that video lays the groundwork for that. Telehealth can help expand access to care, right, for patients, especially those in rural areas, or they're facing some of these social drivers of health barriers, right? However, at the same time, we'd be remiss if we didn't acknowledge that patients can also face challenges in accessing care via telehealth itself, right? And healthcare providers can also face challenges in providing care via telehealth. So when we talk about telehealth, of course, so far, we mainly talked about the benefits, right? How does it expand access to care? Patients are feel more empowered, to take charge of their own health, and all of that is true. However, again, we do need to address what challenges might there be when trying to access care via telehealth, and again, how do we mitigate those barriers? So that will lead us right into this discussion. We wanted to kick it off again with a little bit of an interactive discussion. So the question is, what do you think are some barriers that patients and or healthcare providers may face while trying to access care via telehealth?
Well, I think one of the biggest ones that they already touched on in the video is just that the internet works, right? The internet has to work, has to have enough bandwidth to not only get the audio but the visual, and that can just be um, a real game changer and really frustrating for both patient and provider.
Yeah,
And there
absolutely.
has to be internet, period. There are plenty of places in North Carolina where there's simply no internet at all.
Yeah.
And I had not even thought about what she said about the strength of the broadband. Like they have it, but it's so
Mhm.
weak they have to go to audio only, which is
Yep.
better than nothing, as she said. But I had not considered the strength of it being an issue too.
Yeah, absolutely. We often don't think about it. We think if you have internet access, you're good to go, right? But again, that's not always the case. And actually, that audio and video thing, we're going to get into that a little bit later. It gets even more complicated than that, actually. But yeah, that's definitely something we don't necessarily consider, especially those of us that have broadband access, right? We take it as a granted, but it's often not. Other thoughts?
I do think they made a good point about it's not just that the patient may not have the access, the doctor, the facility may not, because I can think of a couple here in my region that I know those clinics do not have internet access. And if they do, they're still running with something that's just a step up from a dial-up modem
Right.
to transmit basic data.
Yeah,
So again, that
absolutely.
infrastructure, if the infrastructure's not there, no matter what we do, it's not going to work.
Absolutely. Yeah. And I do think you're right. I think that's a lesser made point. Again, the assumption is if you're a healthcare provider, you work in an office, you have a building, you're a hospital, that you have internet, right? That's the assumption. And even if you do, they'll assume that you have enough internet to run, an EHR or a telehealth telemedicine platform, and you may not. And again, a lot of clinics maybe don't offer telehealth or telemedicine because of that, because they just can't support it. Again, they lack the infrastructure, right? Yeah, absolutely.
I think another barrier tends to be residents or patients who just don't know how to do telehealth. Like,
Hmm.
they don't know how to turn their computer on, or they don't know how to turn the video on. And a lot of times they'll have it blocked off, or, they're looking too close or they're too far away. They're looking at their feet, right? I mean, we see this all the time with the seniors that we work with. It's the just the basic skills of how to be online, and especially in a virtual meeting that can get really hairy really quickly.
Yeah. Yeah, absolutely. It's challenging also for a healthcare provider when you're trying to conduct a visit to also sometimes have to be the one who's troubleshooting, like, okay, maybe move your camera a little bit further away. Have you tried turning off your Wi-Fi, turning it back on again? Oftentimes the healthcare staff or providers are the ones doing the troubleshooting for the patient and trying to complete that visit. So it can, yes, it can get really complicated. Absolutely.
Something else that is frustrating for seniors, and I'm assuming it's frustrating for anybody who's accessing the medical system, is that you have multiple patient portals because there is no integrated system and doctors don't talk to each other anymore. If it's not a billable hour, whoever they've got, their overarching entity doesn't want them to do it. And I had someone not yesterday, last week asked me, I got to do all this again because she's got the local hospital here, and then she has specialists in Greenville. And it's two totally different systems, and they're not integrated. So that's frustrating. And that doesn't just apply to medical, to telehealth. That is anything they're doing with the medical system these days.
Yeah, absolutely. And I will say, especially for patients living in more rural areas, right? If you're going a county over for some of your specialist visits, and maybe you have a primary care provider in your county, but again, your specialists are in a different county, that's not the same healthcare system. So you got to have two different patient portals. You have to have two different setups, right? The usernames, passwords, all of that. It just gets more and more complicated for sure to access.
Well, if you listen to the level of healthy skepticism in this conversation toward the medical profession, then think of the most rural counties in North Carolina and the way those people must view medical care and access to it. I think one of the boundaries is mental, of course, is why should I bother? They don't care about me as a person, or some theme thereof. So all the barriers are not necessarily technical. It's um, skepticism toward, is this good for me, and will it benefit me in the long run?
Yeah. Absolutely. Skepticism on both sides. Skepticism on the side of the patients where they're like, well, this isn't even offered where I live. Like telehealth isn't even offered. I mean, we saw that too when we were building our digital skills curriculum. In some of the more rural regions, people said don't mention telehealth specifically because if you do, people have that hesitation of like, well, this isn't even offered where I'm at. So why would I bother learning about this? And then of course, skepticism on the side of the healthcare providers. Why should I offer this service? It's too complicated. I don't have time to like troubleshoot this, right? Or my staff doesn't know about it either. So, the workflow is too difficult, all sorts of things. So yeah, skepticism on both sides. And I think that's an interesting point you made as well. It's not always a technical barrier. Sometimes it's this lack of knowledge or lack of training or just hesitation or skepticism, right? And some of it is valid, honestly. And I think we are on the flip side of that, right, where we're kind of doing work to encourage or implement these strategies. But I think we are on the side where we need to think about how do we address that skepticism or hesitation and how do we sort of assuage that, right? So yeah, for sure.
I think a lot of times it comes down to um, the necessity of it, right? Is there no other option for these patients? And if that's the case, they will kind of have to adapt, right? But if they can still get to the doctor, sure, it takes up half their day and they have to call their granddaughter to take them or whatever, that's something that they're willing to risk, right? It's almost like a social event to go out but I feel like we need to sell the benefit of it a little bit more to our seniors. I know the folks that I talk to, they're like, what's the advantage of doing telehealth? We see the advantages on the medical professional side, right? Like they can just bust out a whole bunch of telehealth appointments very quickly. Whereas there's very little known benefit to patients or at least that we're not explaining in the same way.
Right. Yeah, absolutely. Getting out there and really doing that outreach, I think, is so important for patient populations to really understand, this is a tool for you, right? This is something that we think is going to benefit you, help reduce some of those barriers you might face when you're trying to access care. And something we touched on, I think, last time was, this is to empower you to kind of take charge of your own health. But definitely more outreach is needed, I'd say, for sure. So, all great.
I was gonna, oh, sorry.
No, go ahead, please.
I was gonna say, I definitely think kind of summing up what everybody was saying, that the lack of trust on both sides is definitely a barrier. And I'm hoping that kind of through things like this and other informational, we can kind of become ambassadors for the benefits on both sides to engaging in telehealth and, especially in areas where there are stronger internet signals and more reliable broadband, really encouraging and talking to people and on the value of, engaging in these type of benefits of using telehealth. Because I would say, as far as my interactions here in Charlotte, there is a lot of opportunities to use telehealth, but people are just not using it. And I think sometimes people get pre-overwhelmed by the idea of having to do something. But then when you kind of assuage those fears and they really get into it, it's kind of like, wow, this wasn't that hard. I thought, oh, I was going to have to do all these things, but it's just the same email and the same password. And, so kind of once they get over that fear and have more trust in the process, then they'll be more willing to engage.
Yeah, absolutely. I definitely think, and we touched on this a little bit in the other sessions as well, but yeah, the more training we have, the more outreach we do, sometimes it's just a matter of explaining it, at the level of people's understanding, because a lot of the resources out there, they explain it from it's a person explaining it that already fully understands the concept, right? So they're not really explaining it at a level of for the general public. So really doing that outreach and getting out there, I think, can be so important. And I think we did see utilization rates of telehealth like drop after COVID, but I think what you're saying is exactly right. If we were to do that outreach, I think rates would improve. So great thoughts. Okay, so we will now go into talking about, you guys brought up many of the things we're about to see in the upcoming slides. But we'll just go through and talk about, again, what are some challenges for patients specifically in accessing care via telehealth? So we already touched on this, but broadband, high-speed internet, right? Video call-based visits require a higher broadband speed at the healthcare provider's office as well as the patient's location, right? So again, it's not even enough to just have internet access. If you don't have the high bandwidth or the high-speed broadband, it may not support the video visit. And then remote patient monitoring devices, those typically also require internet access to transmit the data that you're collecting from the patient to a healthcare provider. So for example, if a patient has a continuous glucose monitor that they have on their arm, right? And that's collecting their blood sugar every so often, throughout the day. In order to send that data to the healthcare provider, you need to have internet connection oftentimes. So that makes it again challenging. You have the technology, you have the internet, but if it's not, high quality, it's not going to transmit that data. And then the device isn't really doing what it's meant to be doing, right? I mean, you could still take that glucose monitor, show it to your provider, show them the log of the blood sugars. But again, that's not the point of it, right? The point of it is to enable that continuous care even when you are in the comfort of your own home. So that can be challenging. So we're going to talk about the challenges, but then we're also going to talk about maybe some of the work that's being done to address some of these challenges. So in terms of expanding access to broadband, I think I shared this either in week 2 or week 3, but the National Digital Inclusion Alliance, or NDIA, they do have an honor roll of low-cost internet plans on their website. I can share that link in a follow-up email after the session. But basically, it contains a list of low-cost internet plans that are scored kind of on a scale of good, better, best, and it has the monthly cost listed as well. So that's a resource you can share, again, after the windup of the Affordable Connectivity Program. I think that's an important resource that we are all aware of. And then RHI Hub has a list of grants again, which can provide funding for improving broadband infrastructure. But speaking of grants, of course, I'd be remiss if I didn't mention that the efforts that are going on again in North Carolina. So as some of you may already know, the current governor has, supported the Completing Access to Broadband program. So that's going to be rolling out in the next 2 to 3 years. I believe the vast majority of North Carolina counties have received an award, but essentially those awards have been given out to broadband providers to expand infrastructure as well as last mile coverage. So the Completing Access to Broadband program will build the existing infrastructure in areas where they don't have infrastructure right now, broadband infrastructure, so fiber essentially. And then once that's completed, they'll survey in the county and just see which households that previously did not have coverage now have coverage. And then if there are still some households that, the fiber did not reach, there's an additional stopgap funding that will provide that last mile coverage for those homes. So we're super excited to hear about this. It's a pretty significant investment in broadband infrastructure in North Carolina. So we're definitely excited to see in the next 2 to 3 years, how that plays out, and for rural areas, especially of North Carolina, to have that broadband access. And I'd also mention our team, the Health Information Technology and Telehealth team at the Office of Rural Health. We did launch our Telehealth Infrastructure Grant Program, which I believe we've done already a third wave of it. So there have been 3 waves. But that also provided funding for telehealth infrastructure for rural primary care and OBGYN clinics. So clinics were able to purchase equipment either for themselves or for patients that might need it. Basically anything needed to expand telehealth infrastructure. So that could be equipment, that could be training for their employees, trainings for patients, high-speed internet for the clinic or for their patients. So there is, again, a significant investment in broadband within North Carolina. So I think in the next couple of years, we'll kind of start to see the effects of that. But in the meantime, of course, it still remains a challenge. And even in, we'll have to see the effect of this funding in 2 to 3 years and see if it actually does accomplish what it intends to accomplish. So we will see. Device access. So this is something we've briefly touched on as well, but obviously to conduct a telehealth appointment, patients and healthcare providers need to have access to a smartphone, a laptop, or a tablet in order to do the video or audio visit. And then remote patient monitoring devices, again, they may not be covered by a patient's insurance plan and are typically not very affordable if they're not covered by your insurance. So again, we may have the internet, we may have the skills, training, everything, but if you don't have the device, then again, that's a barrier, right? So yeah. Private space. So this is again something we've talked about, but I think this is this is one that we don't think about often. I think the assumption is, there must be some place where you can do a telehealth visit, especially if the patient's within their home. Or we don't think about it for the healthcare provider as well. But while healthcare providers typically will have access, right, to a patient room that's private, they can go in there, the patient may not have access to a private space. So patients do need access to a private space so they can feel comfortable in discussing their healthcare needs. And as I mentioned, even if the patient is within their own home, they may live with other family members and they may not have, again, that private space, and they may not feel comfortable talking about their healthcare conditions in front of other family members or people that they live with. And then again, access to private space is also really important to protect a patient's private health information, right? So this is, again, I think one of the things we don't think about, but if a patient doesn't have that private space, again, whether it be within their own home or whether it be at a telehealth hub that's at a library or a community center kind of space, they're probably not going to be that inclined to sign up for a telehealth visit. So digital skills, which is another thing we talk about, even if patients have access to devices and high-speed internet, they may not have the skills that they need to use that technology to, efficiently. So in order to access telehealth, patients may need to know how to create and access an email account, open a web browser on their computer or their smartphone, open up and log into an app on their smartphone, or operate a video call. And operating a video call could include several different skills like turning on your camera or unmuting your microphone, right? So those are actually pretty higher order skills, right? You may not even have a laptop. You may not even have seen a laptop ever in your life or know what a mouse is or a trackpad is. So these are, again, those higher order skills where you need to have basic, digital literacy or computer skills before you can learn how to do those additional skills, right? So that can be challenging for patients. And then another thing we don't really think about is the healthcare providers, right? They may also be unfamiliar with telehealth technologies if they haven't received any training. So there are several different, again, telehealth trainings out there. For example, there's EHR trainings out there as well. But I think back to like when I worked in a primary care clinic, a lot of those physicians were trained on paper, right? When they went through their medical training or residency, they computers were not, very common or in use. So they were working on paper records. And for example, I worked with a physician who had worked at the VA, and the VA still uses paper records, or they did at the time at least. So a lot of these physicians either weren't trained on a computer and now they've been handed a computer and just been asked to kind of learn it. And there's been an assumption made about their level of skills as well, right? That, oh, you're a physician, you must know how to operate a computer. And oftentimes they don't, because they haven't been given that basic training. So again, that may be a hesitation for them where they feel uncomfortable or unfamiliar with the technology, and therefore they don't want to offer telehealth in the first place. So I think working to address and support rural healthcare providers or just healthcare providers in general that may not have these skills is super important as well. So just wanted to touch on a couple of digital skilling education resources. Of course, North Carolina Cooperative Extension does have an office in each county in North Carolina, and they provide courses to learn digital skills free of cost in different counties. North Star Digital Literacy offers free online assessments where participants can gauge their current digital skills levels. There's also several other online resources like Senior Planet, I believe, which is offered by AARP. But there's a lot of online resources out there to teach digital literacy skills or to gauge kind of where people are at with their digital skills. And of course, our team has created a digital skills curriculum as well. We're currently piloting this curriculum in 6 counties across the state, but eventually we hope that it'll be able to be rolled out statewide, so it's available to anyone who wants to teach digital skills or health literacy. Yes, Anne.
I also wanted to just make a shameless plug that the Ageless Access Program is also under Department of Health and Human Services. And actually, the majority of us here are from Ageless Access, and we are also a digital skills resource for anyone who might need that.
Yeah, thanks so much for sharing that. I'm sure a lot of people are either aware of resources or provide those resources in this group. So please feel free to share as well if you either provide those or are aware of any resources that might benefit others in the group, for sure. So changing policies or legislation, right? Legislation or policy surrounding telehealth has greatly evolved in the past couple of years, primarily due to the COVID-19 pandemic. So during the pandemic, there were several Medicare and Medicaid waivers put into place that allowed easy facilitation of telehealth visits. However, now that I guess we're not in the pandemic anymore, some of those waivers either face expiration or they're pending renewal. So if those waivers are not renewed, telehealth providers, healthcare providers may face issues in seeking reimbursement for those types of visits. So this is, again, something that we don't really have a lot of control over. Obviously, the landscape is constantly changing. But there are several resources available that are kind of trying to keep up with this changing policy and this changing landscape. So, of course, in the video that we intro today, they mentioned telehealth.hhs.gov, which is a great central hub for staying updated on all matters related to telehealth. They have updates on telehealth policy, as well as detailed best practice guides, which I feel like those are really, really helpful. Those are really specific and they're really in-depth guides. So they have guides such as telehealth for chronic conditions, for older adults, diabetes management, etc. Again, more helpful for healthcare providers because they're really on this side of the issue, but definitely a great resource, as well as a national consortium of telehealth resource centers, which provides resources, insights, and updates to healthcare providers. And we do have a regional resource center. So the Mid-Atlantic would be the region that North Carolina is in. And so we have the Mid-Atlantic Telehealth Resource Center, which again provides more specific insight for North Carolina and other states in that region as well. So workflows for healthcare providers is another barrier. For healthcare providers that are going to integrate telehealth visits into their regular schedule, which includes in-person visits, it may be difficult to set up a workflow for seamless transitions between the two visit types. So I saw this a lot when I worked at a primary care clinic during COVID. So we were trying to implement telehealth at the time. And it can get really complicated when you're seeing in-person patients and also telehealth visits to kind of navigate that transition. So just to give you an example, if a provider went in for an in-person visit, during that time, if the nurse or the MA is getting set up for the next visit, they may call the patient, and try to get that intake data. They may not be able to reach them. They might face issues with connecting video or audio, right? Then the provider comes out. They may have trouble, again, getting in touch with the patient afterwards, after the nurse or MA has already talked to them. So there's a lot of different barriers that I guess healthcare providers can face in trying to make this work and fit into their schedule. And again, that can cause a lot of hesitation for them to want to offer this in the first place. They kind of find it's too complicated. I can't figure out the workflow, so I'm not going to offer it. And again, if a patient or healthcare provider has any technological issues, that can cause delays, disconnected calls, and miscommunications. And for most healthcare providers, obviously their priority is, I want to provide timely, efficient care for my patients, right? So if they view telehealth as something that's going to, again, cause delays and miscommunications, then it's going to cause significant hesitation for them to want to offer that in the first place. So something that might be helpful when we're talking to healthcare providers about establishing workflows for telehealth. Of course, all employees need training on the basic functionality of telehealth platforms. I have found that it's really helpful for clinics or hospital systems to find a telehealth champion. So this is an employee who already has an in-depth understanding of telehealth or has the capacity or desire to learn. And then this person can get the training that they need, and then they can serve as a trainer for other employees to kind of figure out the workflows and do some of that troubleshooting for the other teams as well. And then practicing the walkthroughs of telehealth visits and troubleshooting any issues that arise. So this is something we did in week 3 as well. We kind of did a walkthrough of what a telehealth visit might look like. But I think it would be good for any healthcare providers or clinics that are considering implementing telehealth to do that walkthrough on the clinic end and kind of see what that visit might look like and troubleshoot any issues that might arise. So I have an example in here, which is, let's say you need to do a video audio visit and the patient's video doesn't work. The healthcare provider might be able to convert that to a phone visit by changing like the E&M code or the CPT code, right? So there are ways to kind of troubleshoot. It just takes some time to figure it out, which is why I suggest the walkthroughs. But again, we talked about, the policies and the landscape kind of changing. So it is important to note that there are waivers in place right now that would allow you to do things like convert into a phone visit if the video is not working. And again, if those waivers expire, then this will be a whole other conversation. But given everything that's in place right now, I think these are pertinent suggestions. So again, we're coming to another discussion. I've talked a lot for like 20 minutes. So the discussion question we have here are, what are some challenges that you might face when implementing a telehealth program?
Well, again, I'm coming to say one of the things that I had not thought about was the doctor not being able to manage the technology. And you just don't think about that. Like, you're a doctor. But not only managing it, but being able to balance, like you said, I'm seeing patients in person as well as telehealth. Some of them are, some places have specific doctors that do telehealth all the time, or, they set aside a day and that's what they're going to do. But I'm sure that balance is hard when it's a patient that you want to see, or a patient that you need to see.
Yeah, absolutely. And I'll give you just a quick story about this. So I worked with a physician who had come from an urgent care. So they hadn't really done telehealth because you're in urgent care, right? You're seeing the patients right then and there. But he transferred to working at our primary care clinic. And so oftentimes when we had a patient that was maybe suspected of, COVID or something like that, the physician would go in and I was working, to do their notes and transcribe and things like that. But I would stay outside of the room to avoid any additional exposure. So we would do a video call between my laptop and the physician's laptop so that I could still witness the visit, right? So I worked with this physician and he went into the room and promptly closed the internet, the web browser. And then I had no way of contacting him. And he came outside and was like, "Oh, did you hear that?" And I was like, "No, you closed the web browser." And he was like, "Oh, I thought I was just closing that window, right? So that the patient doesn't see that whatever." And it was just, I had to explain to him, like, if you close the web browser, I no longer have access to view you, right? That's where the video call was. It was within the web browser. So if you close the web browser, I didn't see or hear anything, right? But it's just such a simple thing. Like, again, he's a great provider, just had never worked with this technology before, didn't really understand how it worked. So I think that's something we don't necessarily think about. But I think it's really important because what we kind of are trying to do is, again, we want a lot of the work is around, I think, patients, right? We're trying to encourage patients to get more digital skills, which again is incredibly important. But one thing that I've heard a lot is if the providers aren't offering telehealth, then how do you get buy-in from the patients, right? So it feels like we have to not only get that community patient buy-in, but also the healthcare provider buy-in. And the question is, how do we do that? I guess. But yeah. Other thoughts? Could be related to anything. I mean, this is the discussion question, but I feel like we've gone way past that and really deep into discussion. So really just anything related to what we presented or what anyone else has mentioned, anything at all.
So one of the
I'm
things
curious.
Cool.
that might be, we kind of touched on it last week. And I can't remember who it was that brought it up, but she's a nurse up in the northern border of the state. And that she goes and does the blood draws and the labs and stuff that are part of a visit that are not that you can't do by telehealth. And then you had sent me the information on the community EMTs here, but the ones here have a relatively limited role in what they do, but that it's not just a matter of skills, what the patient knows, what the physician knows, what the nursing staff and rest of the care staff knows. It's how does the community fit into this? I was sitting here before the meeting looking at a map of a little community in Pamlico County that is surrounded on three sides by the Pamlico Sound. It's called Lowland. Most of that area is below sea level. They don't have a lot of infrastructure. They do have EMS and they do have a volunteer fire station and a post office. So, how do we use those? And now the post office doesn't have to have internet connection in the same way that EMS and the volunteer fire folks do. So how do we use the structure that's there to enable telehealth? And I mean, let's admit it, these are volunteer firemen. They don't need an extra job. But is there a way we could do something that puts someone there in that facility that can do it? That is going to be there at certain times to provide that secure nice place for a telehealth visit in the community where they're not traveling from here to New Bern to Lowland is 48 minutes one way. On 2-lane roads. Sometimes they are 1-lane bridges, so it's a little restricted. But then to get out of there and then go to, if they're not coming to New Bern, to go to one of the hospitals or one of the specialists, it's another 30 minutes to 40 minutes, depending on where they're going, and sometimes 2 hours if they're going to Duke or Chapel Hill. So what can we do for them in their community that's community based? And how can we use the resources that the community has to facilitate the access to healthcare, telehealth care.
Yeah, absolutely. And I honestly think you beautifully summed up kind of what we're hoping to accomplish. I think with this workshop series is we're hoping that we can build some of those, connections, and really get organizations to consider, what role do they kind of play in this in the communities that they serve. And how do we kind of connect all those dots, right, to make these comprehensive offerings? So that, yeah, absolutely. You just really summed that up really nice. And I think you had something you were going to add to.
Oh, I was just wondering if you could go back a couple of slides. You mentioned a project that a pilot program in 6 counties.
Yeah,
There we
that's
go. Oh,
mhm.
yeah, right there. Could you tell us a little bit more about that pilot program and where you're located?
Yeah, for sure. That curriculum that I discussed, the digital skills. So my colleague Courtney leads, I think, the 10 o'clock session, and I lead this one. But we work pretty closely together, and we developed a digital skills curriculum and a health language curriculum. So the digital skills is both are really foundational, but the digital skills touches on, again, basic terminology like what is a laptop, what is a mouse, trackpad, and it covers a lot of different topics, but again, foundationally. So what's a web browser? How do you set up an email account? Just general things you might need to know on your computer. Searching for health information online safely, social media, phishing and spam. It just covers a lot of different topics. And then the health literacy covers, again, a lot of different health topics foundationally. So we cover, I think, the difference between an emergency department or an urgent care versus your primary care provider, a walkthrough of what a primary care visit looks like, nutrition, diabetes, high blood pressure, health insurance. We just cover a lot of different topics, again, foundationally. So right now we're working with Cooperative Extension, I think in 3 different counties. I believe it's Sampson, Wilson, and Bertie. And we are working with community paramedics actually in 2 or 3 other counties. So that's the Cleveland, Rutherford, and we're working with Atrium, which is based out of Mecklenburg. So whatever rural counties that they operate in. So we're kind of in the test phase of seeing if the curricula is actually useful or not. By having health educators kind of use it. And then again, we hope to kind of take that feedback, revise the curricula, and then again launch it statewide. So anyone who's doing, digital skilling education or health literacy education has that as a resource available to them.
Is that curriculum available? I can see a lot of applications where that would apply to a lot of the work that the Ageless Access Project is doing, or is it still in process?
We're still in pilot. However, I will say if anyone is interested in looking at that curricula, definitely shoot me an email. I'll put my email address in the chat, but I'm sure you guys have it. And we can definitely set up more time to talk about the curriculum and see if there's any avenues for collaboration for sure. Yeah, because we just want it to be useful. So technically we are still in pilot, but we are still looking for more feedback on the curricula to see if it's effective. So yeah, we definitely welcome. Please reach out to me, and we can definitely set up some time to talk more about that for sure. Other thoughts? Where
Stephanie?
Mhm.
I mean, Anne, sorry. Is this something that Bruce might already be familiar with? Or
I don't think so, but Janelle, you represent Charlotte a little bit better. You're a little closer. Do you know anything about this or how active the CDE is in with this?
No, I'm not familiar. I mean, the majority of the senior work is with you guys. So we do some digital skilling in senior communities, but it's kind of overlapping to other partnership we have because they're in living properties, housing authority properties. But the things that specifically do with seniors is with you guys. That's why I'm here. Like, I need to soak up all this information so so I can get all this good tidbits from you guys.
so, and I think we talked about it before, Bruce Clark, and you're familiar with him? Mira?
Yeah, I think I've met
Yeah.
him at some different events.
Yeah.
And some, I think we're both on the Mideast Coalition as well.
Okay.
Yeah.
Because yeah, he's facilitated some contacts for me with um various research groups. And but and again, this is a kind of a question for my fellow digital navigators here. We didn't do a lot, didn't do a lot of digital equity and access planning, uh, doing plans for organizations here, because people just weren't interested. But when y'all were doing it in your plan with those you worked with, if you did, was telehealth a component of what they were looking at? Do you think even tangentially with an organization looking for employees being able to do telehealth? It seems like it should be part of the digital equity and broadband plans across the state.
I'll say that with Cape Fear, we are working with all anybody and everyone that will listen and be a part of that conversation. Telehealth, or providing medical treatment in any way, shape, or form is one of the tenets. Education and workforce development, those are kind of the three things that has been the focus of digital equity, at least with the Center for Digital Equity, and then also in any of the conversations I've had with Cape Fear and Lumber River. That's what we're trying to key in on as much as possible.
Yeah, Mira, Mira, I think everyone on this call would be interested in a sneak peek at that curriculum. I mean, I'm on the other side of the state from Cynthia and Ann, and our organization has currently funding available from Dogwood Health Trust that a good chunk of that is going to go toward telehealth. So we're trying to learn as much as we can, as quickly as we can, about how best to spend that money to focus it in exactly this topic.
Yeah. So then, yeah, I think I've heard throughout these sessions that people are kind of interested. So maybe I'll set up like some kind of other sort of webinar or something like that about the curricula for expanded access. But yeah, this is really getting me thinking about how I might go about this for sure. But let me talk to my colleague Courtney, and then I'll kind of let you guys know. I'll send out an email to this mailing list so people can kind of know more about what we end up doing. But yeah, I'm kind of, the gears are turning. I'm kind of like maybe doing something a little bit more large scale so more people can attend. And again, kind of get, as you said, Fred, like a sneak peek into this curriculum may be helpful. Yeah, that's a great idea.
The urgency may actually be greater than you think from those of us who, kind of are out there every day. There's a lot of need for what you're doing.
Other thoughts, questions? We did have like this wrap up video basically. I guess I'll just play this, but before I do that, anybody else have any thoughts, questions, anything?
Just one last thing with the extension offices.
Mhm.
They only provide their digital navigator services in some areas, and it's a
Yeah.
very limited number of counties. However, Kenneth Sheeran, who is the head of that part of it, is real. And I don't know if I've mentioned this even to the other digital navigators. If you get an event and they might be able to help, they want to be part of it. And so because here there is no involvement with the digital skills training, even to the extent of teaching farmers GPS. I mean, that's about it. But yeah, they are interested in coordinating and helping where they can because they do have resources. So they, even though they're not active, they're still a part of the system.
Yeah. Absolutely. And they've been a great partner to us in piloting this as well. So yeah, absolutely. Other thoughts, questions, comments? So I will just play this kind of wrap up video and then we'll talk a little bit. It was a really quick, short video. The thing that they don't mention that I want to kind of throw in there is, again, I think we're talking about, the whole session has been about barriers that you may have when you're trying to access care via telehealth, which is ironic because telehealth is the thing that's supposed to help mitigate barriers, right? And so I feel like this video is really important because sometimes, especially I coming from the, telehealth team at the Office of Rural Health, we think telehealth is the future, that's the technology that needs to be implemented. But at the same time, it is important, I think, to recognize that there may be barriers. And so for a lot of patients, in-person visits may still be the best thing for their health. And so finding that balance of like, again, this is a tool. This is a tool to kind of empower you and empower patients to take charge of their own health. This is a tool for healthcare providers as well to maybe reach some of those patients that might have those barriers, while also acknowledging that in-person visits, of course, nothing can take the place of that. And again, finding that balance between the two and really using the technology to its, maximum benefit with efficiency, I think is really important. So that's kind of a great wrap up. This is the knowledge check link for today. I will check with my colleague to make sure it is recording. I think it is capturing your email addresses when you click on the link. But either way, this is the knowledge check link, so you can kind of access that. I will also send this in a follow-up email. We are coming up on time, so before we wrap it up, any other last minute thoughts, questions, or anything? If not, then thank you all so much. I love the discussions. They're so lively. And again, I'll send a follow-up email with some of these links. You all have given me a lot to think about too. And I will see you next week for week 5. Thank you so much, everyone.
Thank you.
Thanks, Mira.
Thanks, y'all.
Thank you.
Thank you.
Thanks.